Technical Advisory. I am Mike Caudle, the chair of this, and according to the agenda, we've asked Teresa Cooper to establish a quorum.
Thanks, Mike. Can everybody hear me?
Yes.
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 Mike Caudle,
Here.
Yvonne Agan,
Here.
Barry Martin, Chris Kaiser,
Present.
Rainer Mullins.
Present.
Mr. Caudle, you have a quorum.
Thank you. Item 3 on the agenda is the review and approval of previous meeting transcript. Does anyone have any comments or suggestions for corrections or modifications of the transcript as was distributed? There being none, is there a motion to approve the previous meeting transcript as distributed?
This is Chris. I'll make that motion.
And I will second.
Motion made by Chris, seconded by Yvonne. All those in favor say aye.
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 All voted in favor, so there's no negative votes. Motion passes unanimously. Let's go to the heart of the matter, and that's item 4 under old business. And Veronica Cecil usually is one that helps us on report of route crossover claims cleanup, July 1, 2014 to the present. Veronica, is this?
I am present. Good morning.
Okay.
Morning, Veronica.
Are we doing a presentation at this time?
Yeah, actually, we can do that. And this will kind of address B too. So we do have the next meeting of the RAP work group on January 13th, and Happy New Year. I meant to lead with that, and let's hope for a healthy new year. And just a quick update on where things are. We've been, there was a subgroup that spurned off of the RAP work group. And I know that John Inman and Teresa Cooper and some other folks have been working very closely with the MCOs to deep dive into a couple of the other issues that plague the RAP coming through correctly. We've also been very much focused on subcontractors, and I know there's been a lot of work around Avisus and some of the subcontractors, and we get a report every week just to let us know where things are, where the MCOs are on working on those projects, and they are moving forward with what I hope the providers see as some resolution and some movement on getting especially back claims taken care of. So we do have some folks from that work on Kentucky Health Net, and they are going to give a presentation on what the changes made to Kentucky Health Net to assist providers in reconciling their RAPs. And let me pull up.
Veronica, who's going to actually share the screen so I can make them co-host?
Well,
I'm sorry, Veronica.
go ahead. I'm looking for my folks. I'm not. Oh, Jennifer Pop, are you?
I believe Annette is on the phone. Is that right, Annette?
Yeah, I'm here.
Yeah, Annette.
Oh, there we go. Okay.
Yeah, I'm here.
Hi.
I'm a newbie to this meeting.
So, and Annette, do you have a PowerPoint that we need to let you say
Yeah,
be able to?
yeah.
Okay. So, Charlie, if you can give Annette Jimerson.
Just made her a co-host. So
Thank you,
let me
ma'am.
stop sharing. And then Annette, you should be able to share now.
Okay, excellent. Okay. Can everyone see the presentation?
Not yet,
Okay.
or at least I can't.
No.
Let's see. Here we go.
Okay.
There we go.
Okay.
Now we can see you.
So, well, first of all, thank you for having me. Again, my name is Annette Jimerson. I'm with the Kentucky Health Net team, part of the group that put together the new functionality for the MCOs to be able to pull their encounters report directly from Kentucky Health Net. This is pretty exciting for us because this is new functionality for us, and hopefully it's going to be able to help you guys in your day-to-day work. And I'm just going to take you through a tutorial on how to use it and the changes that we made. So again, this is a report that shows the encounters, and it's only available to the MCOs. This is the login for Kentucky Health Net. So you would use your provider number as usual. And once you get inside, you'll see the headers up here. And what you want to do is go to Encounter, and under Encounter, there is Encounter Report, and you would select that. And this is what displays. This is the report criteria that we have to pull your report. So the very first item that you see is provider. This is the same field that's across Kentucky Health Net. So what will populate here is a provider number that you entered at your login. The next portion that we have on the screen is optional criteria. If you wanted to pull the report for claim status, you could select paid or denied. We do have required fields for this report. You can select either a member ID or a provider ID. You'll have to select one or the other. The next item that is required, you will need to put either a paid date or a date of service. So when you select the paid date of service radio button, 2 date options will appear. The date of service field is restricted to a 1-month date range. And after you've put all that information in, you select Generate Report. Then you'll see up here in the right-hand corner, there is a download option. And so you would open the file from there. And this is what the report layout looks like. So you would have the billing provider ID and MPI, that number would appear there. And this is showing that this particular one that I pulled as an example is a provider type 31. And it shows member ID from date of service, the MRN number, the MCO ICN, MMIS ICN, the MCO paid amount, TPL amount submitted, Medicare paid amount, coinsurance amount, and deductible amount. Here, this is just showing you that we do have some error messages in place, just letting you know that you do need to enter either a member ID or provider ID, and that the paid date or date of service is required. Okay. And that wraps that up. Does anybody have any questions?
Yes, Annette, this is Chris Kaiser. I just want to be sure that I'm right. This report is only available for, you said, the MCO. So this isn't a report that can be pulled at the clinic level.
Correct. Now, we did implement a supplemental report, which is separate from this, that those providers can pull, but this particular report is only for MCOs. They wouldn't even have access to that encounter tab.
So Annette, my apologies and to the team and to the TAC, because we really had anticipated a presentation on the provider side to this.
Oh, okay. I did not know that.
Yes. So sorry about that.
Clearly, I did not know that.
Yeah.
So I do have a follow-up question though. So if this is available to the MCOs, are we aware, like who at the MCOs are responsible for this? Do they have individual people who are assigned to run this report, or they only do it if the clinic calls and says, hey, we don't have a wrap, can you investigate? How is this, how does this is just used for them?
Yeah, Chris, I think it would be good to hear from each of the MCOs on how they're utilizing the tool, if and how they're utilizing the tool.
Great.
So, I guess I'm trying to comprehend our expectations from the MCOs. Now that so this is access to information they previously did not have?
That's correct. Yeah, they couldn't, so even the MCOs couldn't see whether when the encounter came over, a wrap was generated. So this does help them be able to monitor that. But it would be good to hear from each MCO to see, and we might not have the right people on the call, but if each MCO could speak up and let us know if you all are utilizing this tool yet.
Hi there. This is Jeremy Randall with Anthem. And so we're using this data to pilot with a handful of FQHCs to couple this data with our own internal data, including the vendors for the dental and vision, so that we can make a comprehensive report that we use internally for researching to see if there's something that we've done wrong in calculating our own kind of wrap payment rate. But then also for sharing with the FQHCs to say, hey, here's the status of everything. Here's what's been denied that can be resolved by the FQHC to initiate the wrap payment, that kind of thing. So we are actively using this at Anthem. And I guess, I'm sorry, just one more thing on that. So again, I said pilot, we're piloting this with just a few FQHCs. We are also in parallel developing this, our internal reporting that leverages this data. And once that's complete, we'll be able to share this data for our Anthem members in a much easier way. Right now, it's kind of manual. So that's why we're piloting it. But we anticipate in the first quarter, we'll be able to churn this data out pretty quickly and be able to share it with all the FQHCs pretty easily.
Thank you, Jeremy. Anybody from Aetna on the call and has an understanding of how they're utilizing the information?
Good morning. Can you hear me?
Yes.
That would be Brian Wagner, and I'm not sure. I'm sure that he is using it, but I will make sure that he knows it is and that they're utilizing it.
Okay, thank you. What about somebody from Humana?
Hi, this is Beth Day with Humana Healthy Horizons. I am not actively involved in the encounters process. We do have a team who manages that for us, and they do attend the frequency of calls that occur with the state on our behalf around the encounter process and field any questions usually during that time. And I know that they are very active partners with our provider bases to make sure that we are, actively sending our encounters over every week and making sure that things are correct and flowing back and forth as it should be. I'm certain that this is just another tool in our arsenal that we're going to be able to use to validate that the process is working and do any kind of auditing that might be necessary to make sure that what we're transmitting over is actually processing the way we expect it to through the channels. But there isn't a member of the encounters team on this particular call. As I said, usually they join the encounter call that is specific to that particular part of their piece. But we are actively involved with any kind of anytime a concern is raised from a provider, we're active in that, and we are definitely a proactive MCO when it comes to our encounter submissions and making sure things are working right on the front end.
Okay, thank you, Beth. And Passport by Melina?
Hi, this is Shelley with Passport by Melina. So I'm following up with our encounters team just to confirm that we do use it, and I will let you all know. But currently, I know that anytime a provider reports a wrap issue to us, we do work on it pretty quickly. So I will reach out to them and find out if they're utilizing this tool. Thank you.
Okay, thanks, Shelley.
Mhm.
Let's go with WellCare.
Yeah, this is John from WellCare. Robin Ray, he's our lead on encounters. If we have an RHC or an FQHC that informs us they have questions about their route, Robin is, he's on top of that. What I've done is I've pinged him and asked him for any additional clarification on this particular resource. So I know Robin is very in touch, and he stays on top of all of our route concerns. So if he responds back to me with any additional information, I can share that when we get to our MCO announcements, if that's okay. But right now, Robin keeps a pretty tight handle on any of our RAP issues.
Great, thank you, Johnny. And I don't know my alphabet, so let's go with United. Sorry about that.
Hey, excuse me, this is Chris Burns from United. It's a question I'll need to take back to your operations team. I know they've been doing a lot of good work around encounters and working with the RAP payment. So, but I'll need to follow up with them, and I'll shoot them a message and let you all know what I find out.
Great, thank you. So I think for any MCO that wasn't able to respond, if maybe you all could get back to us and have something available for the next TAC meeting to report out, that would be great. If if you're utilizing the tool and how you're utilizing it, that would be fantastic.
So the other presentation we had.
Oh, sorry. I just wanted to say really quick, I could just give you a really quick, with this presentation, it's not going to look exactly the same, but kind of tell you how the providers see it. If that's what if you're interested in that.
Yeah, that would be great in it.
Okay. So
this is Ron. I just have a real quick question. You made a comment when you were going through this, that this information is only available for a limited amount of time.
You can go back to like any time, but we can only pull like a month's worth of data at a time.
Okay.
Yeah, we found that, and it's also limited to 2,500 records in one pool. So if you pull more than that many records, it will give you an error. It's just we had to limit it based on the amount of data that's out there.
That I understand now. Thank you.
Yeah, it was it was a lot of data once we started running the reports. So the same thing would be so we did create a supplemental report, and those are for the providers through 135. That report, like the encounters, will be found under claims right here. So if you selected the claims, you would see supplemental report, and they would go into the window. And then they would see something it's similar to this. This one, you can still do it by member ID, provider ID, but the layout's just a little bit different. We still have the pay date and date of service that they can search for. And they are also, it still has the same restrictions because of the amount of data that pulls through. But so that's how the providers would be able to pull it. So it's very similar to what the encounters looks like, but it's located under the claims, and it's only available to provider 31, 35, and now I believe provider 16 that we just implemented, the CCBHC provider. And again, once you select generate report, it will do the download, and then they'll be able to pull up their report.
And this is going to give them, again, the same information as far as when a RAP payment was paid?
Yes. If I'm going to stop sharing for a moment and just go out and find, I can't recall off the top of my head all of the data fields, but yeah, it will show the RAP payment.
Will it show you if an encounter hit the threshold and was rejected?
let me take a quick look. And again, my apologies. I thought this was just for the MCO, but let me pull this up quickly. Maybe. Okay. So for the supplemental report, okay, for the supplemental report, again, we would display the billing provider, MPI and type, member ID from date of service, the MRN number, the MCO, ICN, the MMIS, ICN, the MCO paid amount, PPL amount submitted, supplemental ICN, supplemental paid amount, date of supplemental payment, and Medicare paid amount. That's what they would see on their report.
Will it show, again, information on recoupments as well?
We do not have recoupments listed as a date of element.
Is it possible to add that on
Because I don't know about it beyond, but I think that's where we lose a lot of information. And in the system, it's, you know, when the MCO pays, their payment or their information goes to DMS, they acknowledge we've got paid, they pay the clinic the wrap, and then somewhere down the future, a recoupment happens and the MCO takes back their payment. We assume that information goes to DMS, who then says, oh, we've got to take back our wrap. And then the circle goes around and the MCOs then pay what they were going to pay because of the recoupment or whatever the issue was. And then the process starts again. So I guess that's why I think for us, having a path where we can see recoupments would be helpful.
Hi,
Okay.
this is Jennifer Pop, and I'm with Gainwell also. Let me take this back with the HealthNet team and actually the Encounter team also. It may be that that it is pulling in. It may be that we need to see if we can have those pulled in. We can identify those easily in our system because of the way that the ICN looks to us. So it may be that those are being pulled in, and if not, it might be a simple change. So let us take that back as an action item, and then we can follow back up with Veronica's team, and they can share our findings with you guys.
Great.
I do understand it does get confusing because anytime there is a change made to the original ICN, it does trigger the wrap process to do something, right? Based on what we receive. If we receive an adjustment or a void from the MCO, then that triggers the system to perform some type of action on your supplemental payment. So I do understand the need for that, and it may be that it is happening. It may be that it's a simple fix to add that to your list. So we'll take that back, and then we'll get back to you guys.
Yeah.
Thank you, Jennifer.
Sure.
All right. Thank you. Let's get back to the agenda then. And we were talking to Ms. Cecil under report on wrap and crossover. And I had some specific questions that I wanted to ask, and I'm sure the board may also. But one of the things you talked about the last time was one of the MCOs doing a dashboard and piloting with some FQHCs. Can you update us on that?
Well, I think I guess Jeremy mentioned, I don't have the specific details of those. I think the MCOs maybe could talk more about those.
All right. Okay. And to your MCOs out there, whoever is doing that, please include an update on that in your reports later on the agenda. John had, you referred to John before, working on the subgroup, John Inman with KPCA, and he was going to be meeting with Molina and doing some follow-up meetings. And John, do you want to speak up at this time and update your report?
Yeah, this is John Inman with the Kentucky Primary Care Association. Thank you, Mike. We did have a follow-up meeting with Molina, and they were actually looking at the issue already. But we kind of briefed them on the history of the problem and some of the issues that we had seen with missing RAP payments. And they agreed to kind of research some claims and to get back with us. At your suggestion, Mike, the next meetings that we have, we need to schedule some folks from the work group, some clinics from the work group to speak with those MCOs. But as the holidays got upon us and in the beginning of session, that those meetings haven't been scheduled yet, but we hope to get that done in the next little bit. I know that we have our next RAP work group January 12th. Is that right, Veronica?
Yeah, 13th.
13th. Okay. Yeah. So we're still working, but you know, getting those meetings lined up again to be able to include the clinics because we need their input.
Okay. And Ms. Cecil, Ms. Kaiser had asked you the last time about listing of the MCO contacts, and y'all were going to furnish that list to them. Did that go out?
I believe that did. Charlene, do you know? Or Angie?
The list of the vaccine incentives?
No, this was, well, that was a request as well. But it was the list of the MCO liaisons for the RAP work group.
Oh, I have not seen that. That may have been sent out before I got back to work though.
Angie, are you on? Sorry. I don't know if she's on. I apologize.
Yes, I am on. I apologize. Trying to find I was looking to see if regarding that. If I thought it had, but I will double check that. I was looking for that list as we were speaking, and I will, if it has, and we'll just send it again. But if it hasn't, we'll get it out to you right now.
Yeah, we'll have Charlie send it out again, regardless.
Okay. All right. The last time Mr. Martin was talking with you about the large influx of prior authorization by the new PBM, and you were talking about the increase in Medicaid, or excuse me, Med Impact. It had increased their staffing, and that had seemed to level that out. Is that still working?
It is. They staffed up, and now we meet with them pretty much daily, and we look at their metrics, and they are within their performance metrics on the prior authorization. So there shouldn't be any issues. Of course, there's always the one-offs, but you know, and certainly reach out if you all are encountering any. But my understanding is it's operating as normal.
Okay. Thank you. We've already talked about the next work group meeting for that's been set, and we'll go on then to 4C, discussion regarding return to in-person TAC meeting. At the last meeting, the PC TAC agreed to continue with their virtual meetings, with the understanding that DMS was in the process of purchasing equipment so that perhaps by March, we would be able to have a hybrid meeting. Can you update us on the status of the preparedness for DMS to go forward in that regard?
Charlie, I don't know if you have anything else to offer. I mean, the procurement is going through. It has not been procured yet. We don't have it in the house yet. So I think the expectation of an in-person meeting hosted by us is probably remote. It's probably not going to happen. So, you know, unless we want to search for a different site, which would be challenging given the legislature's in session. And, you know, generally LRC rooms or something that we've used in the past, unless there's another site, I'm afraid that DMS is unable to host.
Okay.
If you all want to continue with if you want a hybrid, which is a, you know, in-person and virtual option.
Okay. Does the committee have any comment on this?
Mike, this is Chris. No, I mean, I think that, again, there is a benefit to being in person and to have that dual option and everything, but until DMS is ready, I see no real concern with not just keeping the meeting as we have now virtual. And again, you know, we do have the recent surge issues to contend with, so that adds a factor.
Mike, this is Yvonne. I agree with what Chris is saying. I think with the increase in our numbers and the inability to have a hybrid, I think we have to resolve that we're going to continue as we are now.
Yeah, it's just more on the agenda for just a status report and to see how they're doing, because it talked about some projections as when we might have that capability, and it's not meant to try and change anything, because right now, especially with the Omicron variant kicking up, I'm certainly not interested in an in-person meeting. Everyone else has to decide that for themselves. But that's just to keep it on the agenda so does not go between the cracks, and we'll do that and bring it back up next time just for a status from Miss Judy Cecil, if she doesn't mind.
Sounds good.
Okay. That brings us down to 4D, which is status of additional codes provider type 31 and 35 for COVID-related testing, therapies, and vaccines. Teresa Cooper, I believe you want to speak in here.
Thanks, Mike. I sent Veronica a list of the CMS codes for all of the COVID-related testing and therapeutics yesterday. When I spoke to her yesterday afternoon, she had forwarded that to Ms. Geist to look at. Charlie, I will send that to you to have it added as part of the record. But we just wanted to make sure that those were getting added, especially as the oral therapeutics are emerging, and that 31 and 35s are not overlooked when those are added to the fee schedules. We had that problem with the monoclonal antibodies. They were on for just the hospitals, and our clinics are administering those as well. So I don't know if Veronica or Ms. Geist has any update on that at this point, but it was some information that was submitted yesterday.
Good morning, TAC. It's Lee Geist. Teresa, I did get the information from Veronica and did a quick review, and I understood your key of stars and check marks. The stars have not yet been added, but I have sent it forward, and we will add them to the physician's fee schedule. The monoclonal infusion issue is just a question about how the RAP payment was going to work on it. So I apologize for that delay, but it was just a policy issue and we didn't overlook you, trust me on that. So yes, we are adding them.
Lee, I think it'd be helpful if we could get some indication from Gainwell on timeline, and maybe we can share that back to the TAC.
Right. Well, generally speaking, our timeline has been for adding new codes for new COVID codes. We usually are able to add them rather quickly, but I'll have to, since we just got it yesterday, we'll have to submit change requests and then get the actual timeline from them.
Okay.
And then we can send it back out.
That'd be great. Thank you.
Yeah. No problem. Everything else, and just let me check really quickly, everything else has been taken care of, correct?
Yes, ma'am.
Okay, thank you.
Okay, thank you, Lee. Going on then on the agenda 4E, discuss turnaround time on answers to questions if they are not answered at the TAC meeting, expectations the next TAC meeting or before. This is placed on the agenda at the request of Barry Martin, and I see that he's unable to attend today. But basically, I think his concerns is some of the things that we talk about here are relatively easy to address and get an answer, even though it may not be immediately available at the time of the meeting. And he would like to see it in such a way that to be a process where we can get answers before the 2 months to the next meeting on these types of simple questions.
Yeah, this is Veronica. I definitely think that's a reasonable request. I think the only thing we ask is that when a question is asked and we're unable to respond, is that be sent to us by the requester in writing, just by email to Charlie. And that way we're tracking everything and we can make sure that gets answered and sent back out. I agree that it shouldn't take 2 months to do that. Based on the complexity, we should be able to respond to questions fairly quickly, and that makes sense to go ahead and take care of those. But we do ask that it be sent to us in writing just to make sure that we're capturing, I may filter the question differently than the person intended, and so to have it in writing is just helpful to us.
So if we look at something like the person posing the question, be able to get it to you within a week of the meeting, would you all either be able to respond within 2 weeks or respond saying that this is something more difficult, will take more time?
Yeah, I think that's reasonable process.
Okay, we'll see how that works then, if that's okay with everybody.
Mike, this is Chris. I've got just a question on that. So the response or the question needs to come from the individual and not the TAC representative to say the TAC would like to know whatever and can respond.
That's correct. Thank you for that clarification. It should really come from a member of the TAC. Okay. And then we'll send the response back out to the TAC. So that should be the flow. Now keep in mind, we're talking about just general questions. If you have a provider specific question, we should handle those. That'll be handled differently, but just for general questions coming from the TAC discussion, that's the best way to handle it.
Okay.
Thank you.
So Teresa Cooper, I guess that's going to fall on you to search the meeting here for those type of questions, so we can make sure that the TAC forwards them on to DMS for answer. That's what you call delegation.
Well done, Chair.
And I've got a VAS, and this is rabbit trailing, but you've talked about for Charlie's purposes. Have you all treated her right and she's decided not to retire now?
Unfortunately, no, but if you can talk her out of retiring, I'd appreciate it.
Well, Maybe we can get together and one send flares and the other's chocolate or something other.
There you go.
Okay.
Thank you.
Okay. You're very welcome, and your absence will be very missed by all. So next thing on the agenda then is with DMS staff continuing work from home, can you please provide us with appropriate contact information for policy, billing, and pavement? There's some discussion in my notes about that there've been some vacancies occurred and that information has not been provided about who to contact in those specific areas. Could you comment on that, Veronica?
Yes, you know, as we do our day-to-day, sometimes we don't understand the effect of a staff leaving, and we apologize that sometimes does leave providers are not sure who to reach out to. And one big one was Jacob Wilson, who, as probably most of you recognize that name as you worked with him over the years, especially on rates and reconciliations and all that. So, but I believe Steve Bechtel provided Teresa with the updated contact for that. In general, you know, I think this is just a situation as like with Charlie's upcoming retirement, that, you know, we just need to be more mindful about making sure that you all understand who is the appropriate contact. Otherwise, I mean, you know, generally we do try to, the fact that we're working in a hybrid, so some come in a couple of days a week, some are coming in every day. You know, we try to not have that affect our providers or our members in terms of being able to contact us. So we will try to be more mindful about notifying you all when those key contacts do leave and are replaced. But so the rest remain the same. You know, Lee Geis is the primary contact for a policy question. You know, so the others remain the same.
Is there somebody that will be taking Charlene's place that we would need to know about?
We will definitely send something out to the MAC and TAC members about the transition of that work, of those duties.
Any other questions from the committee? All right, we'll move to 4G, the update on status TAC recommendation to the MAC. And is Commissioner Lee on here?
No, she's not.
All right. Let me say that I received a letter on January the 4th from Commissioner Lee, referenced the DMS's response. And it repeats the recommendation that the MAC directs the DMS to review their same-day multi-visit payment methodology and report back to the MAC, comparing Kentucky's methodology to that of its surrounding and other states to determine if Kentucky's approach is in parity with the majority of other states, and if not, to suggest an approach for Kentucky to become more mainstream with the trends across the country in reimbursement for same-day multi-visit payment methodology. DMS's response, as penned by Commissioner Lee, was DMS appreciates TAC bringing forth this recommendation. The department is in the process of conducting in-depth analysis related to the payment structures for federally qualified health centers and rural health centers. A variety of factors will need to be examined to determine budgetary impact of modifying the current payment structure for the providers. We will continue to communicate with the TAC regarding progress on the analysis prior to developing a final report with findings. And that's a very succinct paragraph. As you might imagine, it kind of brings on some other questions that that I have anyway.
Okay.
And she says that the department's in the process of conducting in-depth analysis. And I'm curious what that in the process is, what has been done so far that you might know about, Veronica.
Sure. So we have asked Myers and Stauffer to provide us, to research and provide us information of more detailed on what other states do around this area. You know, obviously, the consultant who presented to the TAC in the past just provided a very high level, you know, which states have multiple PPS in the same day and which don't. But when you do start to dig down into what does that mean, you know, how are the rates developed? What does the rate entail? You know, we're looking at the rates across states to see where Kentucky is compared to other states and their rate. But so there's in order to truly evaluate this, and since you all have you know, have an interest in comparing us to other states that do this, we're really just trying to do our due diligence to say this is how other states do it. This is how Kentucky could do it. I think what we have to recognize and just be very candid about is that if we do that, that means you're taking services out of the all-inclusive rate and then turning it into kind of a rate by service or service class. And so that means that in order to earn that PPS, you'd actually have to perform that service in the same day. So, you know, all that would require a lot of change in the reimbursement methodology and the rate development. And that's just not a super easy thing to do, but we just doing our due diligence to make sure we understand what that impact, because we want to be able to provide you what that impact could potentially be. I think the other thing we have to consider is that, you know, is there a consensus among the providers to move in this direction? And so, you know, after we do our in-depth analysis and we have additional information to share with you, I think the next question is there consensus? And because we certainly wouldn't want to move forward if, you know, the providers weren't in support of it.
So has someone been appointed as the lead on this project?
So I would probably call myself the lead. Again, you know, we're working very closely with Myers and Stauffer on it. And we don't, because of the in-depth analysis that's required for this, it will probably be, I would say, I'm not sure we'd have anything by the next tax meeting, maybe shortly after that. But we can certainly provide an update of the status of the analysis at the next TAC meeting.
So at this point, is there any meetings being conducted, or is the progress to assign the task to Myers and Stauffer for further information?
Myers and Stauffer has already been tasked with the work to research this and bring the information back to us.
Mm-hmm. Do they have a time period they're supposed to respond, or is that open-ended?
It's a bit open-ended. We're staying in touch with them. Like I said, you know, I think that, well, and of course now the legislature is in session, and just right or wrong, it pools resources for, you know, the work that we'd like to be doing. But you know, that's why I said it could possibly be by the next TAC meeting, but could potentially be after that. But I'd be happy to provide a status at the next TAC meeting.
Is this an internal process, or will stakeholders be brought in at some time?
After we have the information, we will certainly, again, we plan to share it. And I think then the discussion has to happen about, you know, is this something that providers are interested in?
Mm-hmm. Okay. So if I understand it, then y'all hope maybe to be able to do some type of update to the MAC on the 20th, but you're not looking for any real progress until the next meeting down the road for TAC and then MAC. Is that correct?
I don't know. like I said, I mean, we can certainly put it on the agenda and bring an update at the next meeting. It just
Okay.
depends on, you know, again, how far Myers and Stauffer has gotten the information that we have the internal discussions that may need to take place and putting the information in a presentable way. So
And I understand that COVID affected their personnel as it has everyone. Okay. Any other questions of Veronica concerning this issue?
Mike, this is Chris. I don't have a question for Veronica, but just for you, will the letter from the commissioner regarding the update from the MAC to the TAC be attached to the minutes for this meeting today? The official letter that you received.
Charlie, so that was sent to the TAC members, and then will it be posted on our website?
Yes, will be posted, and typically the chair would send that out to the TAC members. We send it to the chair and to the MAC members. But yes, we'll post it on your website as well.
Maybe another rabbit trail, but has the website been updated with the 2022 meeting dates?
For the January
MAC, I'm sorry.
The January meetings they have, I have not scheduled February and beyond on Zoom yet because of the fact that since I'm retiring, the Zoom account is attached to my email. Once I retire, the email goes away. I did not want to schedule a year's worth of meetings and then have to go back and reschedule them all. So we've gotten a generic email set up, and we'll be able to start doing that now. But for the most part, everybody that has a meeting in January, the website at least lists the meeting dates. So for instance, the MAC does have the meeting dates, but it only has the Zoom link for the January meeting.
Correct. I was going to say on the Primary Care TAC website, the meeting dates are on there.
Yes.
And on the MAC website.
Right.
Just a couple things that was included in the minutes that don't show on the agenda. Or let me put it like this. That's all that's listed under 4 under old business. I have a couple things that should be addressed, but does anyone else have something they'd like to address under old business at this time? All right, there being none, let me do this. One of the things that was talked about in there is the status of the DMS work on making consistent the times and days in which providers are to sign off on medical encounters. FQHC's 1 day, some of the others 3 days. And it was stated in there that it was the cabinet's intent to make that consistent. And actually, Lee Geis had requested that this remain on the agenda. So y'all can blame her on that. So what is the status? Has been any movement in getting that done?
Veronica, would you like me to respond to that?
Please.
Our regulation writer is researching all of the regulations that would have to be revised in order to make it consistent across the board, and compiling that listing and working through it as time permits.
Okay, I know this legislation is meeting, and for some reason you all think this bothers your timetable and everything. But
every once in a while we think that. Not every day, but every once in a while.
Okay. So we'll just bring that back up then in 2 months on the next one and see how they're doing, because it appears to be a pending project at this time. And Lee, also, you agreed to prepare and distribute a 1-page document outlining the respective MCOs incentives for people to get COVID so that we'd have it compiled in one document that we could use it to discuss with patients and so forth. I don't know if you've sent that out. I've missed it. Can you advise me?
I may have spoken about it, but it was, Angie, are you on the call?
Yes, I am on the call, and that should have been shared. It was sent out a couple of months ago.
Yes.
I believe it was in February,
Yeah.
November. And
It was shared to the tax. I sent that out to all the tax and the MAC, probably back about the second week in December, right when I came back to work. If you all did not get it, I'll be more than happy to resend it. And I also think that it is on our website. And if
yes,
I
it is
go
on the
look now,
website.
it's going to mess up my sharing, but I'm pretty sure we had it added to the website. But I'll also send the document back out to you all via email.
Thank you so much, Charlie.
Yes, there was an addition. United had changed their time frame on the incentive, so it was recently updated as well and sent out and put on the website.
Okay, that's the only things I had. Does the committee have anything they want to bring up under old business?
No, sir.
No,
No, sir.
Okay, then let's go to 5 on the agenda, which is new business. And we start out under 5A, the announcements from the MCOs. Humana, who's representing Humana today?
Good morning, it's Beth Day. I am representing Humana Healthy Horizons. I have a couple of updates for you guys, and actually one of them was just a reminder of the COVID vaccine incentive that we do offer to our membership. So it was timely that the chair mentioned that right before my turn. We do have a $40 reward in the GoSeat 365 system that our Medicaid members have access to. The Go 365 is an ancillary item that comes along with a lot of commercial plans and I think maybe some Medicare plans, not all the time available to the Medicare or sorry, Medicaid population, but that is a benefit that our membership does have. I personally love it. I get gift cards all the time for using the Go 365 app for any kind of healthy actions that I take, from walking to getting my annual wellness exam. So having that $40 being able to be added as a reward for getting the vaccine is just really an easy get. I get Target gift cards, Walmart gift cards, Amazon gift cards, all kinds of things available to them through that. And that is something that our quality initiative team shares during the monthly quality meetings or quarterly quality meetings, depending on the cadence that they have set with their groups. And we did hand out a one-page informative flyer about this at the fall KPCA conference. That was something that a lot of practices were really interested in, and they did take that back with them to their practices. The second update that I have is that, and this will be actually more relevant for the FQHCs and some of the RHCs, any kind of clinic that would also have behavioral health services available to their membership. And that is that behavioral health provider engagement is actually coming to our traditional provider engagement team. So for instance, I manage KPCA clinic. So KPCA is also going to have me as their point of contact for their behavioral health concerns or questions. So just another measure for us to try to streamline things for our practices and make it more of a one-stop shop for you guys. And there is a map being posted to our website that lets you guys see the regional assignment for groups that aren't perhaps part of a larger health system or an IPA like KPCA. So it does let you know who your rep is. But I think the typical rule of thumb is going to be whoever your provider engagement rep has been for the medical side of things, that's probably who you're going to reach out to, because again, it is going to be a one-stop shop for you guys across the board for those kind of concerns that you have and any questions or notifications you'll see coming from the same people.
Okay, thank you, Beth. WellCare, it'd be Johnny
Hi,
again.
Mike. This is John from WellCare. So I got an update from Robin on the question about the Kentucky Health Net encounter report. Robin said that he uses an individual report that he gets from DMS that contains all of the threshold rejections at the individual claim level. And he prefers that one because it's more detailed than the one that's out on Kentucky Health Net. So when he looked at the one from Kentucky Health Net and then compared it with the individual detailed report that he gets from DMS, he said that report has more information on it. And I know there was discussion earlier regarding, rejections being on the Kentucky Health Net report. But that currently is what he uses. And on our announcements, just reiterate the $100 gift card incentive on COVID vaccinations that's ongoing. And every other Friday, we've been doing this for several years, we have a bi-weekly WellCare informational WebEx that we started way back in the Kentucky Health Days. And tomorrow is our bi-weekly 1 o'clock Eastern WellCare informational WebEx. And we're going to continue to talk about our new exchange plan and better. So one of my colleagues in contracting, H. Michael Falconer, he's going to be my co-host. So if you don't have that invite, let me know, and I'm happy to send it to you. Thank you so much.
Okay. Thank you, Johnny. Etna, is that Becky?
Yes, good morning. Can you hear me?
Good morning. Please go ahead.
Okay. Just want to say Happy New Year to everybody. We have a couple of things that's going on with Aetna. For the providers that was affected by the recent storms, we've suspended the PA requirements and are working around any need for the records that are needed. We are monitoring those as we move forward. If any providers have any issues with claims or the members are having any issues with claims, just reach out to us and we're going to do anything that we can to help the providers and the members. We also have a couple of network notices that went out. We have a new PA form that was loaded on the website for the providers to use. It started 1/1/2022. Also, we have a new mailing address for our client for our paper claims, and those are both located on our provider page. Somebody have a question? I'm sorry. Our incentive for our vaccines, that's going to be coming out in the 4th quarter. And then I also talked to our encounters team, and he is not using the report yet. He uses the weekly reports that's sent from DMS. So he hasn't been using that, the encounter report. He just uses the weekly reports. And that's all we got.
Okay. Thank you so much, Becky. Anthem is next.
Hi, this is Rachel Buchanan. Can you hear me okay?
Good morning. Please go ahead.
Just a couple of updates. First, Anthem Medicaid has added some major healthy rewards incentive retailers, such as Walgreens, CVS, and Walmart, along with a preloaded Visa that's going to be available to our members later in the 1st quarter. And we've also removed some other vendors that were either low utilization or they weren't widely available through the state of Kentucky. The second update that I have kind of builds on one of the items I presented in November, which is also something we've spoken about earlier in this meeting, and that's COVID-19 vaccine provider incentive program. Recently, Anthem has added member and provider incentives for members aged 5 to 11, whereas the prior incentive targeted members 12 and older. During the 1st quarter of 22, Anthem's going to be completing an analysis to see what impact these rewards might be having on driving adult and child wellness visit redemptions. along with member screening and their preventive visits. Our marketing team has also included information and some discussion points during their new member orientations regarding benefits of healthy rewards. And we've also posted the provider communication on the COVID-19 vaccine incentive for this new age range on our website, so providers can access it there. Touching just a little bit on the providers who have been impacted by the December's storms and tornadoes, Anthem's also been providing outreach to those providers just to see if there's anything that we can do to assist both the provider and, you know, see what we can do for them to be able to meet the needs of our members. So we've been doing that as well. And those are the updates I have. I do, however, want to take just a moment. I'm not sure if he's still on or not, because I believe he had another meeting to hop on. But I wanted to introduce one of our new associates because he is, he's going to be the Anthem Provider Experience Point of Contact who will be attending these meetings ongoing. And his name is Brian Richardson. He's Provider Experience Manager over the Louisville area. And like I said, he had been on earlier. He might not still be. I'm not sure. I just wanted to kind of make mention of that he will be the one who will be attending these TAC meetings ongoing. I'm going to hand it over, and if Brian's on, he wants to say hi, he can. But like I said, he may have had to hop onto another call. But I'm going to hand it over to Jeremy Randall with Anthem here for just a moment, just to speak a little bit more on the RAP dashboard and how that pilot has been going with the providers that Anthem has been able to present it to thus far.
All right.
Thanks, Rachel. Yeah, this is Jeremy. So as I mentioned earlier, Anthem has developed a RAP dashboard, which provides an end-to-end view for FQHCs into their RAP payments, and includes, you know, how the claim is adjudicated within our system at Anthem, but then includes, you know, the encounter status as well as the RAP payment information, and any dates for all those different events. So we've been piloting this with a few FQHCs, and we are also actively doing some development work to automate the report. And I'm happy to share the report in our RAP payment work group next week. But are there any questions at this point about it?
Jeremy, this is Chris Kaiser. So when you speak of dashboard, is that something that then the FQs will have access to on an Anthem website to see this dashboard sometime in the future?
That would be our intent. Yes. I mean, we would eventually like to automate the production of it and distribution of it, so that probably through Availity, you would be able to pull it down for your FQHC.
Thank you.
Yep.
All right. Then Molina, who's speaking for them today?
Hi, this is Shelley Fife. Happy New Year to everybody, and thank you for allowing me this time. So I do want to let you all know that our encounters team currently uses the weekly reports from DMS. They will be reviewing the chemist website to compare and possibly use it going forward. Also, we've been super busy reaching out and checking on our providers that were potentially affected by the recent tornadic events that occurred in Western Kentucky. We've also sent messages via text and/or social media to alert all of our members how to replace lost medications due to the storm event. Each member in these counties that are currently active with case management or in the middle of an inpatient stay have been contacted to make sure they were okay and to help them with any healthcare needs. We're also very proud to announce that we've joined the marketplace effective 1/1 of 2022. And so far, everything's been going great. Are there any questions?
I do have a question. Last time you talked about the Molina had partnered with Teladoc and ordered offers members virtual care. Would you care to expand on that? Talk about that a little bit.
I can. Let me get that pulled up. 1 second. Up for me. So I can tell you that it's to help streamline it is not going. Okay, so Teladoc is like a marketplace vendor, and it's more or less just like a platform that the providers and our members can use for ease of being able to do telehealth appointments. So it'll make it easier for them to do face-to-face rather than going in person.
So are they actually doing a visit, or are they assisting in a visit, getting set up with the providers?
They're assisting getting everything set up with the providers. It's kind of like a Zoom, but more protected better. You know, of course, in a perfect world, we wouldn't have to worry about HIPAA, but Teladoc kind of helps cover and hide a person when they need to be there.
Okay, thank you. United, I believe that's Christopher Burns.
Hello, yes. So United's announcements. First, I just wanted to remind everybody about our member incentive for vaccinations. We're offering a $100 gift card to Walmart or CVS for any members who are ages 5 and up and are fully vaccinated after July 1st, 2021. And we're offering that incentive through March 31st. I also just wanted to let everybody know that in regard to the tornado disaster, we have been doing outreach to members and providers for providers to ensure continuity of care, just make sure that everybody's okay. For members, just providing resources for our case management members to make sure that they have any equipment they need, specifically things like wheelchairs, apnea monitors, oxygen, those sorts of things. So we've been doing lots of outreach on that front. Other than that, there are no other particular announcements, and just want to wish everybody a happy new year.
Thank you. We then move to, is there any questions of anyone on the committee for these representatives of the MCOs?
No.
Okay, then let's move to 5B, recommendations to the MAC. The chair has no recommendation. Does any member have a recommendation?
No, sir.
All right, there being no recommendation, then we'll go to 5C, confirmation of chair to attend the MAC meeting on January 20th. And I will confirm that it is my intention at this time to attend that meeting and represent the TAC at that time. And under 5D, new items for discussion. Anyone have any new items to discuss?
Mike,
So
I'm not sure if you saw in the chat, this is Charlotte, but I think Veronica posted the link to the immunization document. I also sent that out, to the link to each of you. And that is where the most current document should always be, because if it's revised, should be updated on the website. So if you all think you're going to use it, you might want to bookmark that link just to have it easily available to you.
okay. Thank you, Charlie.
No problem.
Anyone have any comments and stuff about the oral treatment for COVID that's coming up? And I would love to be able to just write off those names, but it's something like Paxlovid, and I won't even start to do the other one. Has anyone had any experience with those yet? How does the cabinet being able to facilitate the obtaining and distribution of those drugs. The MCOs working, helping us get those so we can get them out to the patients. What's going on? I guess nothing, huh?
This is Lee Geis, and thus far we have not, I have not been privy to any conversations about obtaining that medication at this point. But certainly we can take a look and see what the rest of the cabinet might be involved with.
We've been notified that the local hospital chain, major chain, is out of the treatment they've been given through infusion and things, and we've been notified by the feds that we will expect some of these treatments to be coming in the next few weeks. We don't have any yet, but it's kind of a crisis situation right now. And not only for Kentucky and not only for Eastern Kentucky, but we had a gentleman drive in from North Carolina, a 4-hour drive yesterday, because he said that he could not get any treatment down there, that they told him he'd have to wait 8 hours and it may not get treatment to be the next day. So just concerned about our patients and where we're getting into a situation that we're just going to be, our hands will be tied. There'll be nothing to do at all to help our patients. That's my concern.
Yeah, I think that's a legitimate concern, and certainly one we would share. And as Lee noted, we've not been, notified of any shortages, or I'm aware of the national news around it in some other states, but we certainly can take that back and see if we can get any additional information on that.
I'll PM you with a little more detail.
That would be great. Thank you.
Any other new items for discussion?
Mike,
Yes, Teresa.
would you like an update from DPH on what they're doing with the monoclonals and the oral antivirals at this point?
Yes, would love that.
As of the last meeting, at the end of last week and one this week, the DPH had advised the clinics that were administering 2 of the monoclonals to go ahead and use them up in the first days of this week, because they are not, the Regencov and BAM are not effective against the Omicron variant. So they were hoping to hit anybody that was presenting with Delta. But after the first few days of this week, there's only one monoclonal that is effective against it. It is in very short supply from AmerisourceBergen. So they were expecting to receive 3,500 doses this week, and there's currently a call going on now that someone's covering for me. So I should have more information this afternoon. But that was going to be dispersed to hospitals strategically placed throughout the ad districts across the state, and to hospitals that may have transplant patients that are immunocompromised. The oral antivirals, Pfizer's, is not out yet. The Merck brand is being dispensed to the Walgreens. At least one Walgreens in every ad district will carry that and dispense that, but that is also in short supply, and they expect Pfizer to be even more dire to get. But as those supplies increase, they will be distributed to the FQHCs and RHCs.
Thank you, Teresa, for that update. I won't make any comment about what I think about drugstores getting medicine to administer when perfectly good FQHCs and rural health clinics, well distributed all over the state, are just dying to be able to take care of our patients. But I won't say anything about that. Having not said anything about that, and no one has anything else to comment or say, then 5E, our next meeting is on March the 3rd, 2022, from 10 a.m. to 12:30 p.m. And would ask that you put that in on your calendar so we can be there. Is there anything else before I go to item 6? Okay, so item 6 is adjournment. Do I have a motion to adjourn?
Yes, sir. This is Chris. I'll make it.
And second by Yvonne. All those in favor say aye.
Aye.
Bye.
All those in favor say nay. The motion carries. Thank you all for attending. I hope everyone had a wonderful and safe New Year's, and God bless you.
Thank you all.
Thank you all. Bye-bye.
Thanks out there.